Hi, I'm Pratik, a dentist and specialty doctor. In this video, we're going to be looking at the 7 pillars of clinical governance. The 7 pillars are really important when it comes to interviews. It's also quite an important topic to know about when you come to exam questions. Typically, in interview scenarios, there will be at least one station that is involving clinical governance, and therefore it's important that you know about clinical governance, as well as having some examples for each of the pillars. So now let's move on to clinical governance and look at these 7 pillars. So clinical governance, according to the NHS definition, is a framework through which NHS organisations are accountable for continually improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence in clinical care will flourish. Now that's quite a wordy definition, it's quite a long definition to remember for exam questions or interview answers. So a simpler way to think of it is the following. So clinical governance is a quality assurance process to maintain and improve standards of care for patients, with full accountability of the system towards patients. Ultimately, the bottom line is that clinical governance is there in order to ensure our quality of care towards patients is at the highest standard possible. We're there to protect patients. So we've then got the 7 pillars to look at. Now I'll go into detail about all of these, but I will mention some that are slightly more important than others, particularly when it comes to the situation of interview answers. So we've got the first pillar, which is clinical effectiveness and research. We have audit, risk management, education and training, patient and public involvement, information and IT, and staff management. That gives us the 7 pillars. Arguably, the first 4 are most important. So clinical effectiveness and research, audit, risk management, and education and training. And when I'm talking about most important, I mean in relevance to interviews and exam questions. So now if we look at the 7 pillars in a bit more detail. So the first pillar, clinical effectiveness and research. This is essentially ensuring that we're using the best available evidence and research in order to inform our decision making for patients, so that patients get the best available care. So examples of this that we can use include the use of NICE guidelines for extraction of wisdom teeth, or using endodontic guidelines. All of these things have had research put together in order to provide a guideline for us to care optimally for a patient. Other examples may include the SD-SET guidelines on anticoagulants and antiplatelets. Other aspects of clinical effectiveness and research involve actually doing new research to create new guidelines. This means that our methods and our treatments are up to date, and patients aren't experiencing treatments that are 20-30 years old and may not be as relevant anymore. Again, through all of these methods, we ensure that patients are getting the highest standard of care and therefore get the best outcomes. So then we look at pillar 2, and that's audit. Following clinical governance, we're looking at improving the care that we're providing to patients, and audits are integral in order to do this. So with an audit, we identify some aspect of generally clinical care towards a patient that we can then look at improving. So we identify what we're looking to improve. So this may be patient wait times. We then pick a gold standard of what we want to compare it to. This gold standard may come from existing research, existing evidence, or it may be a gold standard that you create based upon a vision that you've got of what you want to achieve. You then gather information in order to do this assessment. You then compare the information you've collected to the gold standard that you've got, and then you look at what the difference is. And if there are differences, if there's a discrepancy on not achieving that gold standard, then you put into place changes in order to achieve that. But the most important part of an audit that often people forget in interview questions is that you then want to re-audit. So you need to close the loop or close the cycle of the audit and re-audit to see whether the changes you've put in place have actually made a difference. Now, examples of audits that are very, very common in practice, things like smoking cessation advice, looking at comparing radiographic quality based on the FGDP guidelines. All of these are really easy audits that you can mention when it comes to an interview question. So we then move on to the third pillar, and this is risk management. Risk management involves understanding, monitoring, and minimizing risks to patients and staff alike. Additionally, it involves identifying problems that have happened and implementing change in order to minimize those problems happening again. Again, ultimately, we're doing this to improve the quality of care we're providing to patients. So if patients have come to harm at some point, we can identify that and we can change something so that patients aren't affected by it again. Examples of this include hazard reporting or incident reporting. So if someone trips up, if they slip on water, if anything like that happens, it needs to be reported to the responsible individual, and then they can put in change to minimise the risk of that happening again. It also involves risk assessment. So if there is new building work being done, if new equipment is brought into a practice, it needs to be risk assessed to see what risks are present so that they can be mitigated as early as possible, again reducing the risk of harm to individuals later on. And we also minimise risk by following protocols and guidelines that are put in place, whether this is radiology protection in the form of IRR or IRMA guidelines, or whether it is hand washing guidelines that we follow. These are there in order to protect us and protect patients. The fourth pillar is education and training. And this is really important. Dentistry is a continually evolving career, and you're going to be learning throughout your life and throughout your career. Part of this, under the General Dental Council in the UK, we have what is called continuous professional development. The reason we have continuous professional development is to make sure that as clinicians and as healthcare professionals, we are providing the best care for patients. So this links back to the first pillar of clinical effectiveness and research. It means that we're not providing patients with treatments that were good 30 years ago, but actually are now very outdated. If we look at things like antibiotic prophylaxis for patients, that's something that has changed quite significantly just over the last 10 years. And so it's important we stay up to date with the latest research and the latest evidence. For dentists, on the General Dental Council requirements, we have to complete 100 hours of verifiable continuous professional development over a 5-year period. This education and training can be done through study clubs, it can be done through reading journals, online webinars. We've had a lot of online webinars during the COVID pandemic. It can also be in-house training with other members of staff. And on top of this, we can also have work appraisals. Dentists can appraise each other, and this way we can learn from each other. Now, like I mentioned, the first 4 pillars are arguably the most important when it comes to interviews. We can summarise these first 4 pillars in an easy to remember mnemonic, the mnemonic being care. So clinical effectiveness and research, audit, risk management, and education and training. So if you're struggling in an interview situation, you just have to remember the word care, and hopefully you'll remember these 4 pillars. And now we move on to the other pillars. So the next pillar is public and patient involvement. This is the aspect of ensuring that patients are actively involved in decisions that are made regarding their care. So we get a patient's perspective on exactly what is happening with their care, and we may see a perspective that we wouldn't have understood before. So examples of patient and public involvement include the NHS Friends and Family forms. It includes direct feedback we get from patients. And we also often have patient forums where patients can turn up within their local community and feed back information, and this could be one of the ways we can gain information about the local healthcare services. More and more recently, patients are involved on hospital boards. So again, they can provide their input to ensure that the care is maximised and the outcomes are the best they can be for patients. Now let's look at information and IT. Information and IT essentially is looking at how patient information is handled, stored, and moved from one place to another. A lot of the information that we have on patients is confidential, and we have to make sure it's treated like that. We have lots of legislation in place, including things like the GDPR legislation, which are there to protect patients' information and also looks at how we use the information. This also becomes important when we consider things like audit. Typically for an audit, we're going to have to gather patient information, and so we need to ensure that this is done in a confidential manner and their data is protected. In information and IT, we're also looking at the systems that are used to store patient information, so what software is used, how is the software managed. We then move on to the final pillar, and that is staff management. The bottom line for staff management is ensuring that the right members of staff are employed in the right jobs doing what they're trained to do. Through this, we can ensure that patients are getting the best care that's possible because we've got the right individuals doing the right bits of work. Additionally, in staff management, we also consider the employer and making sure that the environment is a safe, nurturing, and friendly environment that members of staff can raise concerns if they have any. Under this pillar, it is also a requirement for the employer to provide good and safe working conditions as well as appropriate management of staff that are employed. Now that's quite a lot of information, and like I said, there are certain aspects of these pillars that are really important, and those first 4 are probably the bulk of what you would ever get tested on. But if you want to remember all 7, an easy mnemonic to remember it by is PIROT. So patient and public involvement, information and IT, risk management, audit, training and education, evidence-based practice or clinical effectiveness, and staff management. We've discussed some examples in this as well for each of the pillars, so it's important that you look at your own work and you can provide examples when it comes to exam questions or interview questions. It is the examples and the application of these pillars to a real life scenario that will get you the extra marks and get you those bonus points, because that ultimately demonstrates that you understand the pillars and you understand the relevance to patients and the relevance to care. Now, a recommendation in this video is of another YouTube channel called theDentlyf. Now this is run by Komal and it's been run for the last 4 years, where she's provided videos on a whole host of topics. The most importantly, and the aspect that I really like about this channel, is that it shows a progression through university as well as advice on applying to university and applying for dentistry. I'll provide links in the description. So that's it in this video. I hope you found it useful, and I hope you're a bit more aware of the 7 pillars of clinical governance. If you did find this helpful, please make sure you subscribe and click the notification bell. If you do have any suggestions or feedback, then please leave a comment or contact me on one of those various social media handles. Take care.